Good afternoon, everyone. My name is Dan Lavalette. I'm the Senior Associate for Client Care Workforce Readiness. I am super excited to introduce our great panel. We have a huge panel of folks here excited to speak to you about seasonal readiness. So in the interest of time, I'll just dive right into some of our introductions. I'm just going to read names, and then as folks speak, they can introduce themselves in their respective parts. But with us today, we have our Director of Client Care Readiness and Planning, Leonard Levy. Soon to join us, we will have Joe Lenz, our Deputy National Assistant Director of Client Care Operations. We have Jamie Snowden, our Manager for Client Care Systems. You've got me, unfortunately. We also have Tricia Mims, who's our Senior Program Manager for Disaster Health Services, as well as Shannon Goodhue, who's our Senior Program Manager for Disaster Mental Health. We've got Stephanie Dawson, who's our Senior Program Manager for Disaster Disability Integration, and Flo Henkin, who I know all of you know, who's our Volunteer Partner for Disaster Casework. So we got a great agenda, folks. We're going to start with a little bit of housekeeping. I already went through the introductions for you. Then we're going to go through, Leonard's going to talk to you a little bit about the Client Care Chief Promotions process. We're going to talk a little bit about the Seasonal Readiness Overview and what that looks like. We'll go into the Client Care Operations Manager position. And then, as always, we'll go into our question and answer session. All right, from the top to the bottom. So folks, if you're here, you know this is a Microsoft Teams meeting. We are here for a full 90 minutes, so hopefully you've got a lot of questions. I think we've got a lot of content too, but I know we've got a lot of time reserved for good questions. Attendees will be able to turn on auto captions. So if you go down in the bottom, I think it's in the bottom right corner of your screen, you can turn those on if you need them. Everybody will come on camera as they're presenting. Folks will go off camera when they're not presenting to conserve bandwidth, and we'll deal with that as we go. Sometimes there's connectivity issues. Everybody's line is muted, so for all intents and purposes, you are in listen-only mode. That is just in the interest of time and to keep things muted and keep things moving. We do ask if you have questions, you type those into the Q&A box. You should see that in the top toolbar in Teams. If you don't see Q&A for whatever reason, don't panic. Some folks don't see Q&A for whatever reason. It's a Teams permission issue. So what we're going to do is we're going to use Mentimeter at the end of the session. The problem is, if we're using Mentimeter, you can't enter your questions until the end of the session. So grab a pen and a paper, write those questions down so you don't forget anything. We do ask when you send in a question, you put in your name and your region just so we get a sense of where folks are asking questions from. We are recording this meeting, and as always, we're going to be publishing this recording to our playlist, our YouTube playlist. So please check that out if you haven't seen those already. We've been doing this for years now, frankly. So we go from the oldest to the newest. So you got to scroll all the way down and see all that great content, but check that out. And lastly, if you are on YouTube and you're watching the recording, at this point, you can go up and you can click this little link up at the top of your screen for a client care program overview from our Senior Director, Jack Herman. And without further ado, I will turn it over to Leonard Levy.
Hey, good afternoon, gang. Thanks for hopping on and joining us, spending some time and hanging out with the client care team today. Really excited to have you. I think as we talk about seasonal readiness, and I will say this is probably the last year that we'll frame it as seasonal readiness. If you've been paying attention to some of the information coming out of disaster cycle services, we're really morphing into a continuous response environment and moving away from more of a heavy disaster season and just really evolving into just continuous response. So as we think about this, again, this is probably our last year of seasonal readiness. Next year will be perhaps a different title, but really the intent is to frame some of the expectations and some of our operating procedures for this busy disaster period. Along with seasonal readiness or readiness in general is cadre development and leadership development as well. And you can see here, we are so excited to have all of these client care chiefs in position, promoted, in place, and the list is growing almost monthly. We're getting a couple of new client care chiefs per month. Really, really excited about this. So as we think about our leadership for client care in this new operating environment, really, really happy to have the client care chiefs that we have. You can see there that we've already identified some folks who have responded to relief operations and served in a client care chief role. Now, some of you may be sitting out there going, well, wait a minute, I was a client care chief and I'm not on this list. And you would be correct. You actually went to a DRO. Perhaps it started as a level 3, evolved into a level 4, and you were the client care lead, the client care chief for that operation. So we recognize there are folks that have served in that role that aren't official client care chiefs. They were essentially provided, or they were given that assignment for that particular DRO, and then they reverted back to their normal gap when they were done. But hopefully that sets the springboard for them to pursue the client care chief role moving forward. So you can see there, just in the little over a year that we've had the client care chief positions, quite a few folks have served in that role. And I will say there's a few folks who have served in this role on multiple occasions, if not more than once, multiple occasions. So there's plenty of opportunities to engage and leverage our client care chiefs moving forward with all of the DRO activity that we have. So congratulations to our client care chiefs. Looking forward to see who's going to fill that, who's next spot. We're going to talk a little bit about how you become a client care chief in the next slide. So as we think about the training requirements, here's a snapshot of the training requirements to pursue the client care chief gap. And pretty straightforward here. I'm not going to read every one of these. I will say, though, that the intent for the multiple discipline training aspect of the required courses is we really want the client care chief to have a general understanding of all of the activities and services in the client care umbrella. So as we think about the client care chief leading all of client care activities on a relief operation, they don't need to be the subject matter experts for all of the different activities for client care, but they do need that familiarity. So we do want the client care chief candidates to make sure that they've taken the introduction or the fundamentals course for all of the client care activities. And we think that really provides a well-rounded perspective with the understanding that those SMEs are going to be there on the operation anyway, serving in that activity manager role. So the client care chief will lean on the disaster spiritual care manager or the disaster mental health manager or any of the managers in client care. They're going to lean on those as subject matter experts, as they should, but we really want the client care chiefs to go into relief operations with just a general understanding and awareness of what all the client care activities are. And then off to the right here, you can see the recommended courses, really good foundational and fundamental courses that are nice to have just to provide that well-rounded perspective of all of the client care activities. So what does it take to be a client care chief after you finished your training? Well, we're really looking for someone who is experienced at the OM level or has served as a manager or the previous chief positions in health services, mental health, spiritual care, recovery, and really looking for some in-depth experience with at least 4 national level 4+ relief operations, all with satisfactory performance evaluations. When we think about the client care chief position, it really is a strategic and a planning position, and someone who interacts with the rest of the operations crew on a relief operation. So not only is it experience, but it's also having some diplomacy and some collaborative savvy to be able to collaborate and organize client care activities in the midst of all of the relief operation activities. So another thing we're looking for is just some endorsements and recommendations from perhaps a region or a division. So making sure that a region supports the client care chief candidate and that they believe that that person is the right fit for what we're looking for in a client care chief. So we're looking for 2 letters of recommendation from the region, from the division, somebody from the NHQ team, perhaps someone who's a well-respected disaster relief operation leader, regardless of their gap. Really looking for that. And then once all of that occurs, we do take this seriously, and we finish off the eligibility with an interview with the National Headquarters Client Care Program leadership. This is not a rubber stamp situation. We do want to make sure that we put the right people in the right position serving in the client care chief role. So really expanding more about the process around this. It really starts with someone who's interested in the client care chief position, working with the disaster workforce engagement team in the region, working through that packet, thinking about these eligibility requirements and what that looks like. Once once that packet is completed and we have the region approval, obviously the region forwards that packet to the division for recommendation. And then it actually goes to the National Incident Command Team, the NICT. And so they'll review that packet because, we're really looking for a high level leader for the client care chief who's going to be interacting with a lot of the OM cadre on a relief operation. And the NICT is a primary component of that. So the NICT will review the packet for concurrence, make sure that everything looks good in the packet. Once the NICT reviews it, they'll provide it to the National Headquarters Client Care Program team with the recommendation, with the NICT recommendation. Client care team takes a look at that, reviews it, and will set up an interview to visit with the candidate and just walk through some familiarization and walk through some scenario-based discussion just to see if and double check that this is the right fit, that candidate is the right person to fill a chief role. And then once that happens, we provide the feedback with hopefully, and for the majority of people, it's a yes. But if it's not quite yet, what we'll do is provide feedback on what the next steps are. So that's really the process to become a client care chief. Again, we've got plenty of space in the client care chief roster for you. For those who are interested, look forward to seeing more of the client care chief position applications come through. So with that, we can jump into our seasonal readiness overview. So as we think about the recent operations order, the commander's intent for fiscal year 25 level 4+ disaster relief operations. There we go. If you haven't had a chance to check this out, please check it out. There's a lot of great information here, but this is essentially this is the version of what we call colloquially the seasonal readiness op org. Again, we're moving into a continuous response environment. It's no longer seasonal readiness, but this really outlines the commander's intent and the major disaster cycle services initiatives for level 4+ disaster relief operations. It is available here on OneSource. Again, if you haven't checked it out, please go take a look at it. We're going to talk about a few of the things that are in there, but we're also going to leverage today's discussion to ensure that we can address some general reminders, some general information from client care that are relevant for and perhaps supplemental to this commander's intent op org. But here's where you go to get it. Please get a chance to take a look at it because it really frames the continuous response environment, and it tries to really demonstrate how the continuous response environment kind of dovetails into the disaster cycle services 5-year vision. It really frames with this continuous response environment that we're in. We should really be focusing in on conserving resources and being efficient with our resources. So there's a lot of general overarching thoughts around how disaster cycle services is going to operate in this continuous response environment. And then it really digs into some specifics with the different groups and activities on relief operations. Again, today we're going to talk about some things that are embedded in this op org, and we're also just going to provide some general reminders and specifics. But anyway, here's where you go to get it. Go check it out, read it. Really packed full of really interesting information, and a lot of it's really going to help you be successful on DROs moving forward. So let's just jump right in. So we're going to start with events, framing events. So here's just a couple of tips and reminders and some general information. Occasionally we get asked or we run across a client, the National Headquarters Client Care Team gets information or runs across a client who presents after there's a event deadline. So the event is closed, but we find out that somehow a client slipped through the cracks, or the client has some express needs that weren't met during the event window. And so there are occasions when we will approve extending an event deadline to meet specific circumstances. So, whether that's extending or whether that's reopening the event, there are some approvals and authorities that we have to work through in order to do that. It's not an easy answer as far as or straightforward answer. Sometimes we have to consider quite a few factors, and a lot of that is really the circumstance of the client. It's also the timeline. It's really, really tricky to understand why we would need to reopen an event 7, 8, 9 months after the event window, but there might be legitimate reasons for that. But here, these first two lines really outlines who the approval sits with for extending or reopening or opening an event after the event deadline occurs. So just some general information about who's responsible for that in the event that you're ever faced with that decision. So here's a reminder as we transition, a couple of reminders as we transition from level 2 to level 3 plus DROs. There is a change about who confirms damage for level 3 plus events. So as we shift from a level 2 to a level 3, just a reminder that the intake workers, caseworkers, and IDC caseworkers cannot confirm damage for level 3 plus events. That's all happening through the DA collection tool, and that all occurs with the DA workers. And so if you're working on a DRO and it is a level 3, just a reminder that you cannot confirm, and you're an intake worker, caseworker, IDC caseworker, not supposed to confirm damage as you open up the case. So what happens is when we do transition to a level 3, we still have to work through the ID and address confirmation. So we still have 2 responders that must confirm ID and address for all level 3 plus relief operations. So 2 responders, we no longer work through the provisional financial assistance. We need 2 responders to confirm ID and address. Obviously, we can work through if we don't have that, we can work through document reviews, things like that. But we do need 2 responders to confirm client ID and address to provide immediate assistance for all level 3 plus relief operations in RC care. The big difference here is that DA component. We really want to make sure that the responders put 0 for the number of responders confirming damage on level 3 plus events, because they're using that survey collection tool, the DA aggregator. That's where that DA information is coming from. So just a reminder to hit 0 responders for confirming damage on level 3 plus events. And we're working on some things. We're thinking about some enhancements to RC care where a lot of this just naturally happens, to where in the future, perhaps when a DRO does shift, it automatically defaults and you're unable to add it. Working on some thoughts around that for the future, but for now, just a reminder to hit 0, and it just makes everything really easy to move forward with that assistance and matching up DA classifications with the cases. And just a general reminder, we want to make sure that we continue to put accurate and real, truthful information in RC care. Just a reminder for all responders, false or erroneous information must not be entered into RC care. We don't put placeholder information. We don't put information in there based on what somebody told us. We really have to put truthful, factual information in RC care. And so really it just comes down to, on the confirmation piece, confirm the things that you've actually seen. If you haven't seen it, you haven't seen it. Be truthful and factual about it. Please do not put false or erroneous information. And quite frankly, if you do, it really is, I mean, it's committing fraud. And it's a violation of our policies and our practices. So just a general reminder there for that. So once we get the events going and we've transitioned to a level 3 and we've worked through the responder confirmations, then the next piece of this is immediate assistance. And just a general reminder here that immediate assistance begins when DA is at least 85% complete in a defined geographic area, which could be the defined geographic area, it could be the DRO, it could be a county by county situation, but it's whatever the defined geographic area is for that DRO. So it's 85% complete, and it has successfully passed quality assurance, quality control from both the National Headquarters Situational Awareness Decision Support, SADS team, as well as the Client Care Programs team, CCP team. So that's when we can start immediate assistance when a DA is 85% and it's cleared QA/QC with SADS and Client Care. And then the last piece here are just around general reminders and information around the events. Want to make sure that we just hit upon the regional and operational account authorizers. It is so important and critical that when a responder is fixing to get on an airplane and deploy to a relief operation, that somebody has ensured that responder has an active RC Care account. It's easy for us to change an account, a user role in RC Care. If the responder leaves, they get on the airplane thinking they're going to go work in a particular role, but when they land, their assignment changed. I mean, because that's never happened to any of us before, right? So we can do that on the relief operation, and the operational account authorizers do that frequently. We want to make sure that everyone has access to the DRO, want to make sure they've got the right user role. Most people show up with the right access because it's the job that they do all day, every day. They get to the DRO, they're going to do that job all day, every day on the DRO, usually not an issue. But if their role changes, getting that changed on the DRO, fairly simple, straightforward. The tricky part is when the responder shows up and they don't have an active RC Care account, because the operational account authorizer can't activate an account or reactivate or create an account. That all has to occur with the regional account authorizer back home. So it's important that as client care responders get deployed, somebody's just checking, perhaps the responder themselves, make sure they can log into RC Care, make sure they've got an active account, making sure that they're working with their application support lead in the region to make sure that if they can't access, that they can access before they leave, making sure that they work with the RAA for that as well. So I just wanted to hit on that for a few minutes. Really important that people that the responders confirm their RC Care account activity is active and all that before they go wheels up to the DRO. Again, once they get on the operation, the operational account authorizer will ensure that the responder has access to the DRO event and RC Care. They'll make sure that they've got the right user role. And most of the OAAs actually monitor the arrival roster for the positions, so they know when somebody's coming when they hit the ground. Oh, they're going to need an RC Care account. They're going to need this user role, and so they're getting ready and being prepared for that. So when the responder shows up and checks in, they can immediately start the user role piece of it to make sure that they've got access to the event and the appropriate user role. So typically regions will assign an operational account authorizer for level 3 for level 3 events. And I will say that for the most part, that's usually an RAA, the inherent RAA for the region. We know a lot of times, though, those RAAs have multiple hats in a region. Sometimes they're not available to serve as the OAA. And so we'll tap another RAA from another region or a backup to serve in that role. But the region should be really working through that for level 3 events. And then we'll make sure the NHQ client care team will make sure that OAA at that point is assigned to the account authorizer list so that we know who's actually doing those account authorizations. The national headquarters client care team will identify an OAA for level 4+ events and coordinate with the DRO for assignment. So again, nothing really different here. Again, typically the OAA is the inherent regional RAA for that affected region. Again, sometimes it's not, and that's okay. Really working and developing a really good cadre right now of some OAAs who serve and support multiple DROs across the country based on their availability and all that. So we're getting to the point now where we have less and less frequency of when it's hard to identify or tap someone on the shoulder to serve on an OAA. But the client care team, the national headquarters client care team, will work on that, make sure that we've got an OAA assigned. And again, the OAA's responsibility on the DRO is to ensure that everyone has the appropriate user role and DRO access. So as soon as they hit the ground, they can immediately go to work in their RC Care role. So that is really it about events, and I'm going to kick it over to our case processing group.
Thank you, Leonard. I was just waiting for my mute button. It's a little slow today. So I am Jamie Snowden, Manager of Client Care Systems, and I'll be going over this slide about case processing. So the first thing that we wanted to talk about was that document review, compliance review, and case administration, that is all centralized underneath the client care program compliance team, led by Chris Davis. So if you are on a level 4+, you don't really have to worry about finding a document reviewer, a compliance reviewer, a case administrator. The NHQ client care compliance lead will assign document reviewers, compliance reviewers, and case administrators for these tasks. That will help centralize things and help us just keep an eye on everything that's going on the DRO. The client care compliance team will build the monitoring dashboards for document and compliance review on the DRO, and they will provide technical assistance to the document reviewers, compliance reviewers, and case administrators on level 3 events and below events. So if you're on that level 4 or above, NHQ, Client Care Center, Client Care Process team, they're going to handle that. But if you're on the 3 below, we'll help give you guys the assistance and any of the guidance that is needed for the document review, compliance review, and case administration tasks. The next thing on the list is the Client Care Center Liaison. It's a very similar name to the Call Center Liaison, but they're actually 2 separate things. This Client Care Center Liaison is a member of the Client Care Program team, and they will serve on my team. They'll be the person sort of behind the scenes monitoring the cases, monitoring the calls that come in from clients about cases, and they'll work with the client care chief and or the recovery lead on the operation and send them the cases. So that way, if we find cases that need a CAC, that they can't get an EFT, we'll send them to you. And the client care center liaison will work with who's ever on the operation to work out a cadence that works best for both parties. Last year, I know we had some DROs that preferred, one message a day that had a summary of all the information, where some people prefer, multiple emails so that they can keep track of each issue. So it's just someone who is on the client care program team who's really just monitoring the cases behind the scene and will let you know when there's cases stuck. That will take off some of the burden on the DRO from, you don't really have to sit around and just check for cases to make sure that they're getting paid. We're also going to be some eyes behind the scenes to help identify them and let you know when clients are calling in and they have concerns. So next thing we want to talk about is editing cases in RC Care. And we just really want to stress that case administrators and DRO exception approvers can edit and correct cases. And again, just reiterating that the case administrators for level 4+ events will be assigned through by name requests by the NHQ Client Care Program team. And then we also just wanted to let everyone know that is something that is new functionality in RC Care for this season is that finally workers in the field are able to resolve a CAC to EFT. So if a client had a CAC and they lost their CAC, but now they can be served by an EFT. Perhaps they got their internet back, or they got a new smartphone. Maybe it was destroyed in the disaster. So previous years, in order to be able to go from a CAC to EFT, you had to submit a technical exception, and someone on the client care program team had to work through that. You no longer have to do that. You can do it yourself. Casework supervisors can go to a lost or stolen CAC and hit replace, and they can choose if they want to replace it with another CAC or replace it with an EFT. This should help take a lot of the burden off, delays in clients getting their services, and also just the burden of having to, get a TE, wait for the TE, get it resolved, and then connect with the client. So we're really excited to announce that new functionality that is ready for this season. And so I believe that is all from the case processing team, and I apologize, Dan, I don't know who I'm kicking it to.
All good. Thank you so much, Jamie. Appreciate that. Next up is our individual support program team. So Tricia, I will turn it over to you for disaster health services.
Well, thank you, Dan. Hi, everybody, and thank you for joining us today. So for DHS, we've had a lot to get ready for this season. We are still Most of you that have been in the field have probably heard us refer to Dharma Bow. This is an aggregate morbidity app that we're using to track communicable diseases in the shelters with a partnership with the CDC. Just for everyone's knowledge, this is not a new process. We have done this paper-wise in the past, and now we're actually moving that and been doing this for a little bit over a year within an app and be able to get reports in timely manners. We also are still using the CMIS and the SKYA app to assist clients in identifying their access and functional needs. We are, working with shelter intake on this, and then of course those general rate referrals to our actual cadres so that we can actually work with the client on those immediate needs. Also, a big news for us as something that's been there and you've heard from January is licensure. And so we are working really well with RMS, GovOps, and within the team to really figure out where that is. And so DHS workers, just so that everyone's on the same page, may only deploy to states where they hold a professional license, unless the state or federal government has issued emergency or disaster waiver, removing such restrictions. Registered nurses possess a compact or you may also hear it said as a multi-state nursing license. They may deploy to any state that accepts that without the waiver being in place. So while affecting the cadre, we do have that availability in, I think, around 38 states. And of course, client care, RMS, and GovOps will continue to be able to provide direction when recruitment is necessary. And so we are really working hard to make sure that's clear. And so it's been a great working process and great team effort from within the team and outside. So we are appreciative of that. So I will pass that off to my colleague at DMH, to Shannon.
Thanks, Tricia. And I want to thank whoever set up the slideshow for using a picture from 10 years ago. I looked radiant, very grateful. So my update is very similar to Tricia's. A lot of the same rules apply for DMH, of course. For those of you who've been working with us, this season, level 4 and above, this will come as no surprise to you. But at this time, in order to be deployed, a DMHer must be licensed in the state where the client is located. So just for specificity on that, there are exceptions, and many states have exceptions written into their laws in advance of emergencies. There is a compact that states can join. 17 jurisdictions have joined that allow us to deploy our entire cadre as soon as there's a disaster declaration. There's also PsyPact, so some psychologists are in a compact, but very few. And that compact may allow them to deploy temporarily or to deploy virtually. It depends on the license that they've purchased. So as you've probably seen on the door, that makes deployment extremely complicated, and shout out to workforce who's been navigating that this whole season. It is not simple, and it can change in the course of a DRO because, of course, a state can add something to their declaration, particularly a license waiver, or we can uncover different laws that protect us to be able to respond. So that was a very messy, I'll say honestly, in the beginning of the season. I think now we're getting a good process in place so that there's clarity. What you see on the door for your DMH position should be what is correct for licensing that's needed for that DRO. Just noting, RNs follow the health guidelines. So even if they are a DMH, if their license is an RN, they follow health guidelines. Same for MDs. We do have a few medical professionals in our cadre. And then I love to get into all the nitty gritty, but I don't also want to bore you with that. Just please keep an eye on the door. Feel free to reach out if it's ever confusing, and happy to answer questions. Thanks. Passing to Stephanie.
This is Stephanie Dawson, Senior Program Manager with the Disaster Disability Integration Program. And it's great to be on today's call. We definitely have been focused on seasonal readiness and really moving into the continuous response mode and really leaning into having that mindset as we work on a lot of the program developments that are happening in disaster disability integration. Some of the things that we focused on in order to get ready for the season, where, as you all know, we've had a significant amount of wildfire and tropical storm and hurricane activity. We did host this past June, we hosted 3 disaster disability integration virtual readiness boot camps. Those boot camps offered really about 5.5 hours of, virtual training that was synchronous training. So we were on live for those 5.5 hours. And really the focus was on preparing our DDI volunteer leaders to deploy to level 4 and above operations, and really going over the fundamentals that are necessary to carry out the basic foundation of the activity on disaster relief operations. So we did see that 68 of our DDI volunteer leaders attended the Readiness Boot Camp, and we had really good survey feedback from them about their experience. 85% of survey respondents shared that they felt more comfortable and had a higher comfort level with deploying. And 96% of our survey respondents said that they were somewhat to very likely to deploy to a disaster relief operation within 6 months of attending the Readiness Boot Camp. So we have seen that some of those results from the assessment are bearing out in reality as we've had some of these major events. We have had a lot of success with being able to consistently identify DDI managers to deploy to operations. And then, as you all know, we are all working very diligently and seeing a lot of success with the DDI manager really being able to lean into the client care team model. And so we've had really excellent client care chiefs like Vic Souza, who I must shout out, who has worked very well with a lot of our a couple operations with our DDI managers, both of those people who also attended our Readiness Boot Camp. So the other thing that we really wanted to focus on in terms of seasonal readiness was to think about proactive outreach to key external partners in impacted areas. And we continue to have discussions about a coordinated effort to do outreach to Centers for Independent Living and statewide independent living councils. We have determined that is going to be a bit more of a longer and strategic project, and we want to be able to leverage the resources and guidance also that community engagement and partnerships can provide to us in carrying out that project. So that's something that we did a lot of brainstorming about, and then also we encourage those existing relationships to be leveraged during operations. But what happened is we actually evolved to a new model that we're trying to standardize, which is where we provide community snapshots to our disaster disability integration leaders as they're preparing to deploy. We provide a community snapshot that includes just some general information about the impacted area, specific disability statistics, and then also specific disability resources in the impacted area. But we have also really tried to lean into making sure that we're identifying the regional program lead and those regional volunteers in the area and looping them in at the point of community snapshot. And then we're seeing that our responders who are deploying to operations are immediately working with their regional program leads. And so any existing relationships with organizations like the Centers for Independent Living, the regional program lead could be there to really support the deployed responder with making those connections. And then we have also been doing targeted partner introductions just to give our DDI managers support in the field. So specifically doing partner introductions to any access and functional needs leads within the impact area or the impacted state. Also making sure that the regional disability integration specialist is part of that formal external partner introduction. And then again, if we do have any existing Center for Independent Living or statewide independent living contacts, we do also include that in the external partner introduction. So that is actually a process that we have mapped out. We're starting to standardize. We have standardized templates. And so we're really working to set the standard that our DDI manager should expect that they get that information and that we're going to help prepare them with that as part of our program service to them as they go out into the field. And so that has been something that works well. And I'll just share as I close out here, in North Carolina, we saw a lot of success with trying to move more into this, really pulling in our regional resources if they're available in the impacted area. And so we had a disaster disability integration, DDI is the acronym, DDI manager deploy to the Hurricane Debbie, the Carolinas, that particular operation. And as you all know, it extended out, there was a widespread geographic area. But when that manager went out, they were immediately able to link in with the regional program lead, actually have them assigned to the operation. And that regional program lead was also able to really identify some local volunteers that they could engage through approval from the DRO that actually went out and they helped in their local community complete some of the accessibility surveying. And then when it was time to transition back to the region, the regional program lead was there to go ahead and continue, and they were aware of what was going on during the national level stages of the operation. And then that engagement has actually led to all of us having an upcoming meeting with a human services and an access and functional needs representative from the state. They just want to know more about the work we do, but that came about as a result of really leveraging that local regional program lead and the value they could bring, and then they're going to be in that meeting as well. So we're trying to do more with leading into that as we start to think more towards continuous response, and then obviously all of the basic program development that we've been talking about over the last year. If you have any questions about DDI at any time or just want more information, don't hesitate to reach out to me or a volunteer partner for the NHQ DDI program, Lonnie Kohler. Thank you.
Awesome. Thanks so much, Stephanie and Flo, for disaster casework.
There we go. And last but not least is disaster casework. But before going into the update, I want to note that disaster casework is the new name for the casework activity. That became effective with the release of ConOps 5.0. Not all IEPs have caught up with ConOps 5.0. So know that if you see recovery manager or recovery care manager in your IEP, it is referring to disaster casework. The disaster casework manager reports to the client care chief in the new ConOps, and recovery planning reports to the disaster casework manager. That said, the headline here on this slide is that recovery planning has been reinstated for all levels of DROs. What is recovery planning, you ask? That's where caseworkers work with clients to develop a recovery plan. They identify roadblocks to recovery and provide referrals along with connections to community resources to help them overcome the roadblocks. As you know, recovery planning is an automatic service for clients on levels 1 through 3 events and an opt-in service for clients on level 4 and above. It can be conducted virtually or in person. Recovery planning begins within 72 hours of intake and should be completed within 30 days. So now, staffing for the recovery planning service will be incorporated into the advanced operational planning and service delivery planning. The working assumption is that 25% of cases will opt in. That's it for recovery planning.
Awesome. Thank you so much, Flo, and thank you all of our individual support program, senior program managers. We are going to skip over our operations section and come back to that in a minute while Joe's on another call. Until then, we're going to just quickly go through, I say quickly, but it's going to take some time to go through our RC Care user support channels, and then we'll take a look at Q&A. So starting from the top and working down, as you are all familiar with, right? I think we put this in every single Red Cross training ever, maybe in every job tool as well. Your first line of support, right, always is going to be your supervisor. So if you have a question, something doesn't look right, something looks strange, right? Just reach out to them and ask them first. And then if they don't know the answer or if they have questions, whole multitude of resources you can move on to. So the next one here we have Listed is the RC Care Intake Hotline. So this is going to be for assistance with case creation. If you have typo issues, like you're on scene, right, and there's immediate there's issues that are preventing immediate assistance. This is going to be when the intake hotline is going to be helpful for you. There's also your RC Care application leads. So these folks are a part of the RAST group, the Regional Application Support Teams. So if you have questions about how to use the RC Care application, what training is required, what are the different user roles, again, right, like with the supervisor, if you see something that doesn't look right, maybe there is a release in RC Care and maybe you missed the email update, right? We communicate regularly with our application leads, so they know when they get questions, how to answer those. We also have, so this is my personal favorite. I'll take my soapbox out from under my desk here. We have our RC Care knowledge base articles. So folks, these aren't mentioned in training yet. We have our RC Care training and stuff from launch, right, that we're still working to update in the future after we do some program work and some doctrine work. But the knowledge base articles are a resource that we're able to update regularly. I think every single day, just about, we edit an article or publish a new one. So if you're not familiar with those knowledge base articles, please take a few minutes and check those out. Those are going to be either answers to frequently asked questions, or they're going to be procedures, steps and procedures. So please check those out. Next, we have our IT end user support. So if you have questions about your account, you can't log in, maybe you went on vacation for a couple months and you came back and you can't log into your account because you were deactivated, that's where you're going to want to start. They're available 24/7. You can call them, or you can go into the self-service portal. If you go into OneSource, you'll find the link. And then next, we have our technical exceptions. So technical exceptions are escalations to the national headquarters team. What are these for? Maybe there's a case error that can't be resolved in the region. There's an adjustment that needs to be made, or there's some kind of a payment issue or payment resolution issue that needs to happen. You can submit a technical exception. We monitor the queue for technical exceptions every day between 10 and 6 Eastern time, 7 days a week, 365 a year. We also have our client care help inbox. So same business hours of 10 a.m. to 6 p.m. Eastern time. But if you have general program questions, things, right, you've already worked through your chain of command, right? You checked with your supervisor, you checked in your region, nobody knows the answer. Reach out to us anytime. You can ask a question. Just don't expect an answer after hours or on holidays, right? Because we're watching the inbox just between those hours of 10 and 6. We have the client care page on OneSource. So we have our toolkits in there. So that's where all of our doctrine and program toolkit pages live. A bunch of great resources in there. And then last but not least, we have our embedded feedback tool. So if you have, you think RC Care is great, but it could be just a little bit better if we did this one thing, go ahead and go to the embedded feedback tool and submit a ticket there. It's actually an IT ticket. Doesn't look like it, but it is. You submit your feedback there, and then Jamie and her team will review it and prioritize it and reach out if they have questions about it. All right, so let's take a look at Q&A for a few minutes, and then we can come back. And so I want to just start by reminding folks, as we said in the housekeeping, right, for anybody that might have joined after when we went through housekeeping, some folks may not see the Q&A box up top. If you do, that's great. Please submit your questions there. If you don't panic. You've got the information for Menti here on the screen, so you can go ahead and just hit, you can pull up your cell phone if you've got that, and you can scan the QR code on your screen, or you can go to menti.com and you can put in the code 15943597, and that's going to allow you to send a question. Katie's on the other end, and she's monitoring our Menti queue. I am monitoring our Q&A queue. So I am going to go ahead and I'm going to turn off my camera for just a few minutes while I work behind the scenes here. It's hard to work on several screens and keep going here. So our first question that we have in the queue is from Marla. So Marla had a question about reunification. She asked who monitors for reunification calls on level 4 and above. Asked if it's the call center liaison or the client care liaison, excuse me, the client care liaison or the, sorry, I'm having trouble reading. Not all DROs assign reunification to the DRO. Leonard, let me go to you. I believe reunification is under mass care. I'm inclined to direct Marla back to the reunification standards and procedures, unless you happen to know the answer to this one.
Yeah, no, exactly right. It falls under the AD of Ops in the mass care branch, so reunification falls in there. So they're the ones that would manage the reunification. It's not a client care activity.
Awesome, thank you, Leonard. And I can't remember who presented on this from our team, but what is the difference between the this is tough for me, it's a tongue twister. What is the difference between the client care center liaison and the quality control manager? Jamie, I think that one was you.
Yeah, I'll take a stab at it, and if Chris Davis is around, she might have some more information about the quality control manager. But the client care center liaison is really the person who's going to, especially if on the DRO there is accelerated outreach, really review all of the cases and coordinate with the client care chief or their designee on the operation about clients that need a CAC, that maybe, can't use the EFT, clients that may be called in and are having trouble using the upload link, things like that. They're not really checking for quality control per se, but they're actually just managing our payment resolution queues and some additional queues that we've set up to make sure the cases don't get stuck. They're not actually reviewing any sort of casework or things that go on the cases to, kind of manage to make sure that things that way are going correctly. They're just making sure that things don't get stuck in the system. And they actually do this daily for all the cases that go on in Blue Sky as well. But we like to assign one person on large operations so that way everyone on the operation has one point of contact and you're not emailing a bunch of different people every time you have a question or getting bombarded with emails from a multitude of people on my team.
Jamie, would you like me to talk about the quality control manager?
Yes, please.
Yes, so the quality control manager is a position that has kind of been lumped up into the centralized team. It is generally handled by a case administrator, but because that work is so adjacent to the compliance related functions, that is something that DROs do not have to specifically assign themselves. That will simply be handled by a member of the centralized team.
Awesome. Thank you very much, Jamie and Chris. Appreciate that. Katie, let me check in with you and see, have you gotten anything in on Menti?
We do have one question that came in, and I think it is going to either be for Shannon, Trisha, and or Stephanie. So the question is around, is there still a call center that the former IDC activities handle from 1-800-RED Cross or redcross.org?
That team was stood down just last week, so that team does not exist.
Thank you, Shannon.
So thank you, guys. All right, Dawn asked a question, will the slides be available? They have a lot of info on them. Dawn, that's a great question. So we will be sending after the event, we'll probably do it tomorrow morning. We will send out an email to everybody who registered to attend but wasn't able to make it with a copy of the recording and the slides. And then we'll send out an email to everybody who registered and was able to attend with a copy of the slides, the recording, as well as a quick participant survey. The idea, we try to ask a few questions in the registration form to see, kind of gauge the level of understanding or the level of comfort on the topic. And then we try to do a post-event survey and see if we were able to increase the comfort level on the topic. So you can expect to see that sometime either later this afternoon or tomorrow morning. All right. Any other, Katie, are you seeing any other questions here?
I have one other question in Minty. Oh, nope, I've got a couple more coming in. I take that back. So the question is, what is the difference between the two emails, clientcare@redcross.org and clientcarehelp@redcross.org, and what type of requests go to each? So I can take that one. It's actually one and the same. It's called Client Care Help. So if you're searching in the global address list, you'll find it under Client Care Help, but the email address is actually just clientcare@redcross.org. So you can send any of your non-urgent programmatic questions or questions related to RC Care. You may also be contacted from the Client Care Help email address to ask any questions that somebody may have about IT tickets or your technical exceptions.
Awesome. Thank you very much, Katie. I got one more in here. I'm not sure. Let me just pause and see. There we go. Okay. Well, this is an interesting question. So Laura asked, Leonard, I think this one's for you. Laura asked, I would like to see a continual readiness discussion on the regional level. Does that happen?
Yeah, I think it's interesting question, observation, and would agree, right, that continuous response is not just about the large scale relief operations. We see more of the regional responses, the flash floods, just the weather events that don't make the large scale national news, but really put regions in an environment where they are continually responding. So I think it's a great observation. Client care could certainly help with that. What I would really point you to, though, is to connect with the regional programs branch. So James Tittle is the senior director for the regional programs branch, and just talk to him and his team about what that would look like for your region. But agree, I think it's something that needs to occur because the regions are in this continuous response environment. Aside from the day-to-day single multifamily fires, just thinking about the volume of the level 2 and level 3 storm, windstorms, floods, tornadoes, the whole thing. So really good observation, Laura.
Awesome. Thank you, Leonard. Appreciate that. I think so. This is one for Trish. I can't remember who spoke to this one, Trisha or Shannon, but question is from Judith, and she said, if the IDC team that specifically handled health services and disaster mental health calls through 800 Red Cross was stood down, who are these calls being handled by?
I can take that. Currently, right now, the process is being operationalized by ops, and so there are, and the calls are still going through the call center, and more guidance of that will be going out. But currently, those calls still go through the call center, and from there, they're being taken care of.
Awesome. Thank you, Trisha. Appreciate that.
And Dan, I've got one for probably you, Leonard. It's a question about RC Care access. And can you speak a little bit to the timeline that somebody's access to a DRO should be granted if they request it before they arrive?
Yeah, I don't think it should happen until the responder checks into the relief operation, simply because we want to make sure that everyone has the appropriate access that they need. Something could happen, the responder could get delayed by a day or two, and just from a control perspective, we want to make sure that everyone has the appropriate access. So I don't think we would preload access for someone we know is arriving. We really want to make sure that responder is checked in, because that's also going to drive what user role they need on the DRO. As we talked about, and a lot of folks on, that are with us have gone through this experience. You go wheels up thinking you're going to do one thing, you go wheels down and you've got another role that you're going to be doing on the DRO. So that would just create more administrative burden to do it on the back end. So really we would wait for the responder to check into the DRO and then work through that process. And I will say that when a responder checks in and they need access to the event in RC Care, the OAAs and the crew that handles those IT tickets are doing those literally within minutes. Now, granted, there are some times where it takes a little bit longer, But within an hour or two of checking in, most responders have the access to the event and the user role that they need to work their tasks. And yeah, things happen. I know that there's somebody, each one of us could come up with an example, in the last 3 years where that didn't occur. But with an automated system that we use now, and with the attention that the OAAs have on this, also working with SRT and some other folks to make sure that as people arrive, get the access that they need, things are happening really, really quickly to make sure that folks get access. So it should happen. I don't want to say it should always happen in a matter of minutes, but I will say that within hours of checking into an operation, most responders get the access to the event and the user role that they need.
Thanks. I think we're caught up on questions, and Minty, Dan, for questions that are relevant to this call.
Awesome. Thank you, Katie. Yeah, that's one thing, folks. I don't know if we mentioned that in the housekeeping specifically, but we're going to try to stay as close to the operations topic and seasonal readiness. So apologies if we didn't read your question. There's also a few that are very, very detailed and might require kind of a lengthy conversation. So we'll follow up with you offline. We didn't forget about you. Just wanted to mention that. We do have one from Whitney, and Whitney is in the Pacific Islands. She asked, is there a best, Jamie, I think this one's for you. She asked, is there a best contact to do a deep dive on RC care roles, specifically looking for DSC versus casework supervisor access?
Yeah, I would suggest, first off, there's a knowledge article that I'll find the number for, that does cover the roles and what each role can do. But otherwise, I would just suggest emailing the client care help inbox, clientcare@redcross.org, specific questions and information that you might want. And then we can help get you the answers to that. Additionally, if you use the training sandbox for RC care, you can log in as each different role and see the different kinds of access that they might have, and that should be able to help answer some of those questions.
Thank you, Jamie. All right. All right, folks, any additional Q&A? Unfortunately, our call that Joe is on is running a little bit long, for being completely candid and honest. So we are working through these questions, and then once Joe's able to join us, then we'll go into the ops stuff. But if folks have any additional questions, please feel free to submit those into the Q&A or into Menti. Looks like we got another one. Chris, we got one for you. Is compliance situational, or something that would last from DR to DR?
I'm not entirely sure that I understand the question, but I'm going to take a stab at it. Our compliance process is iterative, based on what we know about emerging fraud threats, emerging trends with waste and abuse. Some of that we know from our internal data. Some of that we know from internal partners in risk assessment and fraud fighting and in cybersecurity. We do have some things that stay true that we monitor every DR. And that just goes from one DR to the next. But some of it does change a little bit depending on what we know about a specific compliance situation. And so different folks may be monitoring different things depending on what we know the threat level to be. And if I didn't answer your question, please toss something in the chat and let me know.
That was fantastic, Chris. Thank you very much. Appreciate that. Did you happen to get anything else in on Menti? Checking
No,
with you.
I think
Okay.
we're pretty steady over here.
Well, I think we might have to do a little song and dance, Leonard. After all, we've resisted this long.
Well, a good marketer would say that this is an excellent cliffhanger for the next office hours. And we can introduce Joe and talk about the position in the next office hours. We don't want to keep anybody that, from moving forward through their day.
All right, folks. Well, you heard it there. Clearly, we've got a lot of operations underway. So Appreciate everybody who was able to jump on the call. Let me turn my camera back on real quick, but appreciate everybody that was able to join us today. And as I mentioned earlier, we're going to post this recording to our YouTube playlist, so you'll have it. We'll send out an email to everybody who registered or who attended, and just ask that you spend a few minutes to fill out the survey, everybody that was here. As Leonard mentioned, we will get an introduction. We'll get Joe on the calendar for our next office hours. So stay tuned for the topic, for the date and time. Can assume it'll be some Thursday between 3 and 4:30. That's our MO. So keep your eyes open for that. And yeah, just appreciate everybody's time. And we'll let you have a little bit back to your Thursday afternoon. So thanks, everyone. Appreciate you joining. Talk to you soon.
Thank you, Dan.